Namaste and good evening, everyone. Honorable guests on the dais, distinguished guests of the dais, young delegates. First of all, I congratulate all the scholars for their wonderful presentation and the innovative ideas. At this G20, India's presidency of healing, harmony, and hope, I take this opportunity to speak on the sustainable healthcare. You call it as a human conservation, or one of our professors said about restoration. So I'm going to talk on health in particular. And me being an Ayurveda doctor, I would like to speak on how Ayurveda can be a very sustainable healthcare system and need of the hour. You all know that Ayurveda is a holistic Indian system of medicine. It is India's very rich and valuable heritage and culture. And Ayurveda encompasses the philosophical, spiritual, and the psychosomatic perspectives of the human health. It's a comprehensive healthcare. Now it talks about the healthy food and the lifestyle. The very objective of Ayurveda is swasthasya swasthya rakshanam aturasya vikara prashamanam. Maintenance of health in a healthy individual is very important, which is preventive. Aturasya vikara prashamanam, curing diseases of an unhealthy, which is a curative approach. Please note that both these perspectives are of very much sustainable in nature. How? Let's look into how the healthy lifestyle that Ayurveda recommends and the unhealthy practices that we are doing. Ayurveda enunciates that many illnesses can be prevented by healthy and disciplined food habits alone. It emphasizes on the systematic food habits, involvement of Tanu, Mana, and Panchendriyas, mind, body, and five senses. The World Health Organization recently has observed that, watching TV, mobiles while having food, not concentrating on the food, is one of the most important cause for the brain damage. Which is what is said in Ayurveda. Kale satma shuchir hitam, snignosna lagu tan mana. Tanu and mana, the involvement of tanu, body, and mana, mind, in having food. It has told as, the rules of food intake, your indulgence, your focus on food intake is not just, it is a rule of food intake. That is what is said in Ayurveda. Kale, timely food. It's time, having food at the proper time is an absolute necessary. Repeated disturbances in the biological clock can lead to many illnesses, right from gastritis, constipation, irritable bowel syndrome, ulcerative colitis, or even to the cancers, just because you are not having food at the proper time. Not just that, having the proper digestion, assimilation, and metabolism of the food is very important for the maintenance of health. Rogaha sarvepi mandagnam. The very root cause of all the diseases is indigestion. So, the very proper digestion of the food alone can maintain the health. So, not just that one, but the proper quality and the quantity of food. It stresses on the significance of proper digestion. Let food be the medicine is the mantra of Ayurveda. Food. Ayurveda always identifies the medicinal values in the food, spices, and the herbs. Take for instance, ginger. Ginger is a very good digestive. There is no other better antibiotic for the GI issues than the ginger. Garlic is a very good for reducing cholesterol. It can remove the clogging in the arteries. Garlic alone. Cinnamon, chakke. It's a very good nerve tonic. It can restore the health of the nerve. Cumin, which is very rich in antioxidant properties, is a very good carbonative, digestive, antipyretic, and it can treat gastritis. Turmeric, I need not say, is a very potent anti-cancerous drug. It's an anti-allergic drug. It's a good immune booster. Pepper, long pepper, again, very good appetizer, very good digestive. It increases the bioavailability of the other medicines. Coriander. Why I'm talking all those things is, it is there in your kitchen. It is there at your homes. So please, feel the medicinal values and the importance of it. Coriander can protect your kidneys. Coriander alone can balance the thyroid hormone, which is the principal hormone. I need not tell about holy basil or the tulsi, which is an elixir of life. It's a sacred plant before every house in India. This is a very good antiviral, antibacterial, antimicrobial, anti-malarial, antipyretic. What else you want? Neem, a potent antiviral. That is why you have, neem leaves. The air of the neem leaves can prevent viral infections. Fenugreek, Menthia, is a very good anti-diabetic agent. Ashwagandha, a potent strength drug and good for weight gain. We have ashgard for weight loss. We have snake gourd for skin health. We have bitter gourd for diabetic problems. We have bottle gourd for the cardiac health. Bottle gourd can protect your heart. So what I mean to say is, all these gourds your health. Do you need more other medicines? You have all these at your fingertips. And you please note, all these are bio-friendly. All these are biocompatible. They are good for your body. Let's look at the, and I must tell, there are no side effects, or if the side effects are there, very much negligible. And all this falls in the frame of sustainable perspectives or parameters. On the other hand, let's look into other conventional medicines, which are synthetic chemical medicines. There is a saying, there is a pill for every illness, and there is an ill followed by the pill. Look at the antibiotics that is commonly used. This can disrupt the gut balance, can kill the good germs in the body, can cause from a simple side effects to a serious side effects. Look at the painkillers that is very rampantly used, randomly used. It can bring irregularities in the heart. Steroids. It can induce diabetes. Chemo drugs, it can damage any organ, right from heart, kidney, liver, whatever. So, not just that, it can even hamper the memory, thinking of a human being. So what I meant to say is, the medication side effects can bring new illnesses, and these are away from the sustainable perspectives. Yeah. And look at the what we are taking through food are fruits and vegetables. Pesticides. Pesticides can damage the nerves, can bring nerve disorders in children and to the elderly. It can cause ADHD disorder, a nerve disorder in children, and a Parkinson's disorder in elderly. Preservatives in the food, which contains nitrosamines, they can transform into carcinogenic agents. They can bring cancer. So the air, the water, and the food what we are taking has one or the other ill effects on the body or toxic effects on the body. Then how can we prevent ourselves from the toxic effects of these things, medicines or food or the fruits? Ayurveda has these preventive and curative measures. How? You all know massage. Massage is not a amusement. It's not an amusement measure. It's a very scientific therapy which can increase immunity in you, which can increase the strength. It can remove the toxins from the body. It strengthens the muscles, joints, bones, and it can stimulate the functions of every organ and the system in the body. Let's look into the Panchakarma. You all might have heard about Panchakarma, the word, which is the strength of Ayurveda. The very 5 detox therapies: Vamana, the medicated vomiting; Virechana, the medicated purging therapy; Nasya, nasal administration of medicines through nose; Basti, the medicated enemas; Rakta Mokshana, bloodletting therapy. These are scientifically designed from time immemorial to remove toxins from the body, and have been in practice from 5,000 years back. So what I mean to say is, don't you think all these essential and should be an integral part of health maintenance in our daily life? So preventing health or preserving health, and the disease-free life is possible by undergoing Panchakarma periodically. See, we subject our vehicles periodically for services, don't we? We subject our vehicles for to ensure the smooth journey all through year. And why not the preventive health practices be made compulsory? So my request, or you can say the inputs towards the health policy from this dais, a very great platform, is like, when the government can make vehicle insurances mandatory, why not the human health and wellness practices mandatory? So Ayurveda's preventive strategies or therapies should be part and parcel of the lifestyle for the maintenance of the health. And that is number 1. Number 2, what we have now is an illness treatment insurances, correct? The health as healthcare policies or health policies. A paradigm shift towards wellness insurances be made compulsory or mandatory to ensure a healthy society. I would like to quote Dr. APJ Kalam's statement at this juncture, that prevention through Ayurvedic system is the best way to bring down healthcare costs. So with this, I conclude my talk saying, Sarve Bhavantu Sukhinaha, Sarve Santu Niramaya. May all be happy and disease-free life. Thank you. Thank you once again. Thank you, Dr.